Hey folks, Dr. Hagmeyer here, and we're continuing our thyroid series titled The Most Commonly Asked Questions About Hypothyroidism. Today's question's from Corey down from Florida, and she writes, Dr. Hagmeyer, why am I going through bouts where I'm losing my hair and gaining weight and feeling depressed one month, then losing weight, experiencing heart palpitations, and having anxiety the next? Well, I've been taking my medications the way the doctor prescribes, but I think he's missing something. When I hear this, folks, the alarm bells are just going off, and I become pretty suspicious that one of two things is really happening. You're either being over-medicated with whatever thyroid medication you're taking, whether it's Synthroid or Cytomel or Synthroid and Cytomel or Synthroid and Armour or Armour and Cytomel. You're either being over-medicated or you have an underlying autoimmune disease that's destroying your thyroid gland. Now, for those of you that are watching this video, this is what I call the autoimmune Hashimoto's roller coaster. I know a lot of you can really relate to that, because here's what happens, and I've heard this a million times. You experience the weight gain, the brain fog, and the hair loss, and the depression, feeling cold all the time, which again is all of those hypothyroid symptoms. And then a couple of months later, you might feel fine, and then a couple of months later, again, now it's back into some hyperthyroid symptoms. So again, the anxiety, the heart palpitations, the insomnia, the clumps of hair that are falling out. In the case of Hashimoto's, when the immune system attacks the thyroid gland, it's destroying the thyroid gland, and it's causing the thyroid hormones to spill excess thyroid hormone into the bloodstream. And that's what's responsible for all these symptoms. It's the excess thyroid hormones in the bloodstream. And again, this excess thyroid hormone overstimulates your body's metabolism, and this is what causes, again, those symptoms of hyperthyroidism. So again, the anxiety, the insomnia, the pounding heart rate, and again, the weight loss, which I know for a lot of people, if you're struggling with hypothyroidism and you start losing weight, that again is one of those things that kind of makes people happy. But again, that's not how you want to lose your weight, okay? Over time, what happens is, as this gland just perpetually, continuously gets destroyed, it loses its ability to secrete sufficient amounts of thyroid hormones, keeping up with all the metabolic demands and ultimately leading to all the symptoms of hypothyroidism. And that's really the end stage, because what happens is most cases of Hashimoto's involves a very slow but steady destruction of the gland with gradual worsening of these hypothyroid symptoms. Okay, that happens, it's just a matter of time. So if this sounds like you need to act and you need to do something, and you need to start thinking about prevention. You need to start thinking ahead. What am I going to do to get ahead of this? Okay, because honestly, this is only going to get worse. Okay, so if you're not sure whether or not you even have Hashimoto's, you really need to be tested for this. This is something that's absolutely critical, because unfortunately in the conventional world of medicine, people that have Hashimoto's and people that have what's called primary hypothyroidism are treated exactly the same. So whether or not your doctor tests you for Hashimoto's and he finds out and tells you that you do have Hashimoto's, the treatment doesn't change. It's still the mindset of let's just replace these hormones. Now, there's a video I did titled, How Do I Know If I Have Autoimmune Thyroid Disease? And this video really explains these antibody testing, or the antibody tests, and the various kinds of tests that you really want to have done. There's a lot of information packed in that video, so I really encourage you to learn more about those tests. And there's also a lot of great videos that I've done that explains functional lab testing and the kinds of tests that we run in our office as it relates to people who suffer with thyroid problems, okay? So I hope you enjoyed today's quick video and just this explanation of why you experience symptoms of both hyperthyroidism and hypothyroidism. And I hope that you don't give up this fight, okay? I know some of you out there are just feeling like there's no light at the end of the tunnel, and I want you to tell you that's definitely not the case, okay? If you're struggling, give us a call. Visit our website. There's a lot of great information there. We have a lot of great videos posted on our website, lots of testimonials for people who probably felt just like you. So you can get better, just don't give up, okay? Stay tuned with us. A lot of great videos coming your way. Take care.